Good afternoon. My name is Tiffany Midkiff, and today, along with two subject matter experts, we will be discussing research in psychological career alternatives in a community setting. First, let's discuss what psychological career alternatives in a community setting is. In American society, there are many alternatives to psychological career fields. Whether we realize it or not, from the start of our lives, we are surrounded by professionals that are in these fields. It may be the family and child counselor who visits a mother and their newborn child to ensure their mental health, or the grief counselor helping a family through a loss. Even our children are surrounded by people in this discipline. Teachers, school nurses, the principal, and most of the school staff have training on how to help our child become mentally fit. The school counselor is state and federally certified and trained in psychological techniques to be our child's guidance counselor and therapist. Those working in the psychology field may have a specific certification or degree that qualifies them for this job. Research is the driving force in every field of psychology. It is how we educate the general public and how we learn the best course of treatment. As the discipline of psychology changes and treatment becomes more complex and sophisticated, research becomes increasingly more valuable. Today we will discuss the advancement of research in two of these fields of psychology in a community setting. Our experts today are Catherine Pike and Dr. Bob Spalding. Catherine Pike is a social worker with her own counseling practice. She comes to us with 19 years of experience working with children and adults in a community health practice. She is also a professor of social work at Austin Peay University. She has a master's in social work from the University of Texas and is a licensed mastered social worker. Dr. Bob Spalding has 30 years of experience in individual, couples, group, and family therapy with his own practice for the past 15 years. He is a professor at USF in the Marriage and Family Therapy program. He has a doctorate from the University of North Carolina School of Medicine and is a licensed master family therapist. According to Mrs. Pike, social work efficacy is due to the research done in randomized clinical trials, or RSTs. It has advanced the effectiveness of programs in parent-child relationships, early child development, child abuse, motivational interviewing, cognitive behavior therapy, substance abuse therapy, as well as many others. However, the challenge that social work research faces is the replication of research in a practice setting. In RST, the client is more likely to continue the family with therapy and perform better or embrace the process than in a real-world clinical setting. The settings are different, therefore the reaction and approach to therapy will also be different. This makes the implementation of research results difficult. That being said, social work techniques have become the forefront of research in a research-supported intervention, RST, because social work can focus the applied research to solve real-world problems in a variety of settings. This type of research is more applicable with social work processes and techniques. RST becomes valuable as we continue with social work research because the conditions of a RST can be adapted in a practice setting and provide a database for various effect size to determine which service provision characteristics are associated with the most desirable outcome. For more information about social work and research, refer to the Society for Social Work and Research. For more information about mission, discipline, and job opportunities of social work, refer to the National Association of Social Work. Dr. Bob Spalding states that family therapy research has been the driving force for effective systematic treatment and knowledge as therapy changes and become more complex and sophisticated. Research has shown that family therapy can be standalone or part of multidisciplinary treatment intervention. Family therapy research allows for researchers to obtain results across a large group and individual outcome studies conducted in a local community setting. It provides a diverse client group in a realistic clinical environment. Family therapy research proves difficult to implement and practice because of the disconnection between the clinician and the researcher. Research settings are often based on trends and probability, while clinical settings are based on maintaining creative and dynamic approaches to implement therapy techniques. For more information about family therapy mission, discipline, and job opportunities, refer to the American Association for Marriage and Family Therapy. For more information about family therapy research, refer to the Family Process Institute. Catherine Pike believes that RCT research increases efficiency in social work for a variety of programs. Dr. Bob Spalding believes that the research for family therapy is the driving force for overall advancement of this discipline. Ms. Pike says that social work is the forefront of RST research, while Dr. Bob Spalding says that research has shown that family therapy can be used as a standalone or multidisciplinary intervention. RST research is most needed and effective for social work, according to Mrs. Pike. Dr. Spalding believes that traditional research is best suited for family therapy because the flexibility of research in large groups or individual studies in a community setting provide for a realistic research and clinical environment. They both agree that the number one challenge of implementing research in practice is the replication of the research environment and techniques in a clinical environment. For more information, please refer to these references. Thank you, and have a great day.